Richardson, and I'm with Edgecombe Community College's nursing program. Today, I will be talking with you all about opioid abuse. Opioid abuse affects Nash and Edgecombe counties. It affects many populations. It affects me directly, but you also have your family members, just random people that you may know that it also affects, but you just don't know it. Some of the definitions that I have here are dependence. Dependence is the state of relying on or being controlled by someone or something. Then you have addiction. Addiction is the compulsive physiological need for and use of a habit-forming substance characterized by symptoms upon withdrawal. Some of the factors that you have with opioid abuse are your psychological, which is your anxiety, your depression, and your critical illness. A lot of us suffer from anxiety. I know I do. Then you have depression, which is going on, and a lot of people don't know it. So they use opioids as a coping mechanism. Then, like I said, your critical illness. Critical illness, you have people in the hospital for cancer, and just having minor surgeries that they may need pain management with. With pain management in healthcare, as a nurse, it's not what we perceive it to be, but what the patient perceives it to be. And it's just up to us to relay that message to the medical provider, and they give them treatment. Then you have your environmental and your social. Your environmental factors are your childhood abuse. You have destitution, which is also known as poverty. And you have unemployment, and you have family history of alcohol and drug abuse. Also, under genetics, you have family history of alcohol and drug abuse. There are also a lot of people in Nash and Edgecombe counties that have that suffer from alcohol abuse and other types of drugs that are being used. The unemployment rate nationally is high. So some of the ways to cope, as I said before, is with opioids. It's something that you have to rely on. It gives you a different state of mind. Next, we have the medications that are under opioids. You have fentanyl, which can be placed on the skin, and it reaches your pain receptors. Then you have oxycodone, you have hydrocodone, you have codeine, and you have heroin. Many of us know that heroin is usually injected, and that's one of the street drugs that you have. But your fentanyl, your oxycodone, and your hydrocodone will more likely be prescribed through your doctors. Some of the receptors that they reach are your mu, delta, and kappa receptors, and those again are your pain receptors. Some of the signs that you'll see when someone has taken these medications are pinpoint pupils, which is just as it says it is. It's pinpoint. It's the size of a pinpoint. Then you have reduction of pain. Then you have slow speech. You also have warm flesh skin. Those signs can last anywhere from 4 to 6 hours, just depending on how much of the medication that you do take. Then next we have our effects. After taking these medications and a tolerance is built, the person may have an overdose. With an overdose, that is the ingesting of too much of one drug or substance. Some of the signs that you'll see are loss of consciousness, dry mouth, pale clammy skin, or even blue lips or nails. When you have an overdose, most times if emergency care is called for, they'll give you Narcan, and Narcan reverses the effects of the opioid that you have taken. It can be given, and within 5 minutes or so, just depending on how much you did take, you can have effects from it, and somebody will come back. But like I said, depending on how much you took, you can also go back out again or lose consciousness again. But next, I'll go on to talk about hepatitis C. Hepatitis C is the most common with opioid abuse, and specifically with injection, which like your heroin, injecting the drug. Hepatitis, it cannot be cured, but your symptoms can go away. Your first symptoms that you'll see will be usually within 6 months. But some of the things that you'll see will be jaundice, you have yellowing of the eyes, different things like that. But you'll also have loss of appetite, abdominal pain, fatigue, depression again, and jaundice, like I had said before. But that's just one of the many things. You also can experience HIV, which we all know about, and which I say is long term and something that you cannot get rid of. Next, I'll go on to say recovery. That's probably about the best step that we have here within this process. You do have some negative things that you can suffer from, which is withdrawal, which is commonly caused by the non-use of the drug. Sometimes people choose to actually stop using on their own for many reasons, or you just don't have that drug to use anymore. So the treatment that they'll usually give you is naltrexone and clonidine. Naltrexone, it treats the it's an opioid antagonist, and it blocks the opioid receptors, and it causes the withdrawal symptoms. Clonidine is used to treat the physical symptoms that you may have from the withdrawal. In conjunction with what you may be going through with the withdrawal, sometimes you may be put into therapy. With therapy, that helps you to battle this a little bit easier. You have group therapy and you have family therapy. With group therapy, you'll come in contact with individuals that have also experienced some type of substance abuse or opioid abuse, and that allows you to talk with them, build new relationships, help to overcome it, and just to move on with your life. Then you have family therapy. As I had said before, you may have family history with some people may be in your family that may have had alcohol or drug abuse, or you may have experienced childhood abuse. That's the time where you can talk with your family and you can find out what may have triggered it for you to start using those opioids, or whatever the case may be, that you used it as a getaway. So that time is to be able to open up and become therapeutic, and just know it targets your mind, your body, and your spirit. Just allows you to really know who you are and get down to what really happened and how you got there. Like I said before, Nash and Edgecombe counties are affected widely. Here I have depicted some of the graphs from Nash and from Edgecombe, and here you can see the deaths that have come from it. From 2011 to 2015 in Edgecombe County, it kind of tapered off from 2013, but as you can see, it continuously rose from 2011 to 2015. Then you have Nash County here. In 2011, it was pretty low, but then the deaths kind of increased. But hopefully here today, I brought awareness to the topic. I'll let you know a little bit about what you can see, and sometimes you may even have a family member that, like I said, you don't know that they're going through this, but some of the signs, like the pinpoint pupils or the reduction to pain or the slow speech, you can kind of recognize it, and maybe you can form an intervention with them and possibly, help them out to maybe recover from it or to engage in therapy. But you can bring them to a point in their life where maybe they want to get out of this. But like I said, hopefully I brought to you the awareness. I have helped you to understand what opioid abuse is, and hopefully you can take this knowledge and share it with others, and continue to bring other people to a point in their lives where they can possibly move on from this. Thank you.